Hey everyone, welcome back to the channel. Today I have a really important and urgent update for anyone living in the UK, especially those who are age 60, 65, or above. If you or someone you love relies on NHS prescriptions, you absolutely need to watch this video from start to finish because there's a significant rule change under consideration that could affect millions of people across England. This isn't just a small administrative tweak. This is something that could directly impact your health, your finances, and the way you manage your medications. So I want to break everything down in simple, clear terms. I want to explain exactly what's happening, why it matters, who is likely to be affected, how much it could cost you, and most importantly, what steps you should take to prepare so that you're not caught off guard if this change goes ahead. The NHS is a cornerstone of our healthcare system, and prescription charges, or the removal of them, can have a huge effect on people's daily lives, especially those living on a fixed income. So let's get into it. Right now, under the current rules in England, if you are age 60 or over, you are automatically eligible for free NHS prescriptions. This has been the case for some time, and it's a policy designed to make healthcare more accessible for older people who often need multiple medications for chronic conditions, whether that's diabetes, high blood pressure, heart disease, or other age-related illnesses. The age threshold has been frozen at 60 for some years, meaning that anyone who is 60 or above automatically qualifies for free prescriptions. There are also other routes to free prescriptions, such as being under 16, being a full-time student aged 16 to 18, receiving certain benefits, or having specific medical conditions that qualify for exemptions. So there are a number of ways people can avoid paying prescription fees, but the age-based exemption is one of the most widely used. Millions of people rely on this rule every year, and it saves them hundreds of pounds annually, particularly those who require multiple prescription items. For many households, this free prescription policy is more than just a convenience. It is a crucial financial support that ensures people can stay healthy without having to choose between their medications and other essential living costs. However, there's a significant change on the horizon that could alter this long-standing arrangement. The government has opened a consultation on a proposal to align the age at which people are automatically exempt from NHS prescription charges with the state pension age. In other words, instead of automatic free prescriptions starting at age 60, the proposal suggests raising the threshold to match the age at which you are eligible for the state pension, which is currently 66, but gradually rising in line with ongoing pension reforms. This is a substantial shift. If implemented, it could mean that people aged 60 to 65 who previously received free prescriptions may no longer automatically qualify. Instead, they would be expected to pay prescription fees unless they meet other exemption criteria. While this policy hasn't yet been officially implemented, the consultation itself signals serious intent and is part of the government's broader approach to managing NHS costs and aligning benefits with the evolving demographic and financial pressures facing the healthcare system. So why is this change being considered? Well, the government has cited financial pressures and the need to manage the rising costs of healthcare as primary reasons. NHS prescription charges have been relatively low compared to the overall costs of running the healthcare system. But when you consider the millions of older adults who receive multiple medications every year, the total cost adds up to billions. Aligning the prescription exemption age with the state pension age is framed as a way to modernize the system, reflecting the fact that the population is living longer, the state pension age has increased, and the original exemption threshold hasn't changed in decades. Essentially, the government argues that this adjustment would ensure that free prescriptions are targeted at those most likely to need financial assistance, while older working adults who are not yet at pension age and may still have income streams are not automatically exempt. Of course, this is a contentious issue because many people between 60 and 65 are semi-retired or living on fixed incomes themselves, and even small changes in costs can significantly affect their household budgets. The financial logic may make sense on paper, but the human impact is a completely different story, and that's why this is such an important development to watch closely. If this change does go ahead, who would be affected? Let's break it down. Anyone currently aged 60 to 65 who is used to receiving free prescriptions under the existing rules would be directly impacted if the age threshold is increased to match the state pension age. They would potentially need to pay £9.65 for each prescription item, which may not sound like much at first, but if you take multiple medications every month, the costs can escalate quickly. For example, someone taking 5 prescription items per month could face nearly £50 in monthly charges, which amounts to over £500 per year, money that could be critical for household expenses, rent, bills, or food. It's also important to note that people who are already above the current threshold, over 66 for instance, or those who qualify for other exemption categories, such as medical conditions or benefits, would continue to receive free prescriptions, so the primary impact is on the transitional age group. Furthermore, it's worth noting that this change would only apply in England. Scotland, Wales, and Northern Ireland have different prescription policies, with some of these nations already providing free prescriptions more broadly across all ages. That means the impact is localized, but still substantial because millions of people in England fall into the 60 to 65 age bracket. So how much could this actually cost you if you were affected? Let's be realistic and put some numbers on the table. The standard NHS prescription charge in England is £9.65 per item. If someone takes multiple prescriptions each month, which is common for people with chronic conditions, those costs add up rapidly. Taking 3 items per month would cost almost £35, while 10 items per month could cost nearly £100 per month, adding up to more than £1,000 per year. That's a significant amount for anyone on a fixed income or relying on part-time work and pensions. For those who take multiple medications, one potential way to reduce costs is through a prescription prepayment certificate, or PPC, which allows you to pay a fixed fee for a set period and cover unlimited prescription items within that time frame. For example, a 12-month PPC currently costs just over £110, and for anyone taking more than 12 prescription items per year, this can result in considerable savings. So while paying out of pocket for individual items could be expensive, there are strategies to mitigate the cost if the exemption is removed. However, the key takeaway is that anyone currently relying on free prescriptions between ages 60 and 65 needs to consider these potential costs seriously and start planning ahead. It's also important to clarify the status of this change. Right now, nothing has officially changed. The consultation has occurred, and the government announced in 2023 that the free prescription age remains at 60 for now. That means anyone who is currently benefiting from the exemption will continue to do so until an official change is legislated. However, the consultation signals that this is on the government's radar and could be implemented in the coming years. Because of the way policy changes are rolled out, there may be a transition period or grandfathering provisions for people already within certain age brackets, but there's no guarantee. This is why it is crucial to stay informed. Policy changes can sometimes come into effect quickly once legislation passes, and being unaware could mean unexpected financial consequences. Therefore, even though the change is not immediate, preparation and awareness are the best strategies. You might be wondering, why does this matter more than a small prescription fee? Well, there are several reasons. First, there's a health component. People taking medications for chronic conditions may skip doses if the cost becomes too high. Skipping medication can lead to worsening health, hospitalizations, and in some cases, emergency care, which ironically costs the NHS even more in the long run. Second, there's the financial impact. Many people aged 60 to 65 are semi-retired or living on fixed incomes, meaning even seemingly small additional costs can create significant strain on household budgets. And third, there's the risk of unexpected change. If you assume you are safe because you are currently over 60 and the rules shift after your birthday, you could suddenly be responsible for paying for prescriptions that were previously free. This is not just a theoretical concern. Similar policy shifts in the past have caught people off guard, particularly when communications weren't widely publicized. The combination of health risk, financial strain, and policy uncertainty makes this more than just a minor inconvenience. It is something that could directly impact people's lives in a meaningful way. So what should you do now if you are in the affected age group or care for someone who is? First, check your eligibility. Go to the NHS website and confirm whether you are currently exempt from prescription charges. Make sure you understand if you are covered under existing age exemptions, medical conditions, or benefits. Second, stay informed. Keep an eye on announcements from the Department of Health and Social Care, as well as reputable news outlets. Policy changes will be publicly communicated, but being proactive can give you a head start in managing potential impacts. Third, budget for the possibility of paying prescription fees. Even if the change does not happen immediately, planning ahead can help you avoid sudden financial strain. Fourth, explore options such as prescription prepayment certificates, which can reduce costs if you take multiple prescription items regularly. And finally, check other exemptions that might apply to you, including medical conditions, low-income schemes, and benefits that could maintain your access to free prescriptions. Being prepared and proactive is the best way to protect both your health and your finances. There are also some frequently asked questions I want to address because I know many of you will be thinking about these points as you watch this video. For example, if you are already age 65 and have free prescriptions, will you lose them? Likely not, because changes generally affect people in the future who are approaching the threshold, not those already benefiting under existing rules. Another common question is whether this change applies to Scotland, Wales, or Northern Ireland. The answer is no. Prescription policies differ across the UK, and some nations already provide free prescriptions for all residents, regardless of age. Some viewers may ask whether a prescription prepayment certificate will automatically be applied if they lose the free prescription benefit. It won't. You will need to choose to purchase a PPC if you want it, so you should calculate whether this is cost-effective based on the number of medications you take. And finally, people want to know when the change will happen. There is no confirmed date yet, but the government's consultation and ongoing discussions suggest that it could be considered in the near future, so remaining alert is essential. Ultimately, this is a personal issue intertwined with broader policy. Millions of people rely on NHS prescriptions every year, and any change to the exemption rules could have ripple effects across households and healthcare outcomes. While the government may view this as a budgetary adjustment, for individuals it represents a potential increase in day-to-day living costs and an added layer of complexity in managing one's health. This is why it's important to not just sit back and assume that everything will remain the same. By staying informed, planning ahead, and exploring available options, you can protect yourself and your family from any unexpected financial or health consequences. In conclusion, the key points are simple but crucial. There is a proposed change that could shift the automatic prescription exemption age from 60 to match the state pension age, currently 66. The change has not yet been implemented, but it is under serious consideration, and the consultation process indicates that the government is exploring this pathway. People currently aged 60 to 65 should stay informed, review their eligibility, consider budgeting for potential prescription costs, and look into strategies like prescription prepayment certificates to mitigate any financial impact. While the policy may make sense from a governmental cost perspective, it could significantly affect the day-to-day lives of older adults who rely on the NHS for regular medications. Awareness and proactive planning are your best tools to navigate this potential shift successfully. If you found this video helpful, make sure to hit that like button, subscribe to the channel, and click the bell so you'll be notified as soon as any official updates are released. If you or someone you care about is in the 60 to 65 age bracket, please share this video with them, because this is one of those situations where knowing in advance can make a real difference. And I'd love to hear from you in the comments. How would this potential rule change affect you or your family? Are you concerned about increased costs for prescriptions? Or have you already been considering options like a prescription prepayment certificate? Let's get a conversation going so we can help each other navigate this potential change together. Remember, staying informed is your first line of defense, and taking action early is always better than waiting until a policy is implemented. Thank you so much for watching. I'll continue to track this story closely and will bring you the latest updates as soon as they are available. Until then, stay proactive, take care of your health, and make sure you are fully aware of your rights and options under the NHS. This isn't just about policy, it's about your well-being, your budget, and ensuring that you have uninterrupted access to the medications you need. Stay safe, stay informed, and I'll see you in the next video.